Just yesterday, there was a story out of Omaha, Nebraska about opening a psychiatric emergency room to ease a bit of the population of a correctional facility. Now, the proposed emergency room is said to not only alleviate overcrowding in the prison, but it will also be serving the community. Now, the CDC reports 2.2% of ER visits around the country result in transfers to another facility, including psychiatric facilities. So, doctors, based on that statistic I just mentioned and, based on what we just heard is happening in Omaha, what do you think about this idea?
I think honestly that conversation or developing the story that I read yesterday as well is definitely an interesting story. It's something that as an ear physician, we always do have a little bit of a situation with psychiatric patients because they're the patients that come in with a mental condition. And that is basically something going on with them. Basically, it might not be physical, but it actually is mental. So sometimes we as clinicians, as caregivers, as family members, we kind of oversee this, oh, he's just a little bit depressed and whatnot, not pay too much attention to it. But actually that is a very common situation occurring within our society, and we got to take this very serious because it is a mental illness and it can be treated, which is the most cool thing about this. It's, when you go to the emergency room, we will definitely do a medical screening exam on all our types of patients with psychiatric situations. But whenever they come in, we always do a medical screening exam, and then from there we determine the patient could go home, have to be seen by psychiatry within the hospital, or basically transferred to a psychiatric department. That statistic is actually very interesting, where I was reading that article that you mentioned it, and it said that 50% of our patients, or I'm sorry, 50% of those inmates do have a psychiatric illness. Wow, so think about it, 50% of them have a psychiatric illness, and that is definitely be beneficial for them to be seen by psychiatrists in a more timely manner and alleviate some of the basically the resources within the emergency rooms. I think it'll definitely be beneficial within the community to have that extra resource available to all of us.